The claim that I'm refuting today is that a multimodal approach to treating children with ADHD is better for children in the long run than using medication. My opponent's secondary claims were that parents should be educated on ADHD, teachers must be educated as well as on other behavioral disorders, and third, that behavioral intervention should be taken into account before medication is used as the route. My refutation is that on the feasibility of this claim, and that multimodal approaches are not the most cost-efficient or effective methods of approach, and that treatment should be individualized to the child, not broadened and generalized. So my response to the secondary claims are that, to the first one, that professional education for parents is costly and often ineffective. And the source that she used, I felt was irrelevant to the first secondary claim, was that she cited Amen, which is the author of Healing ADD, and cited the rate of divorce in families with children with ADHD. But the book actually focuses on ADD, which is a completely different disease, and it has different manifestations and therefore different treatments. According to Jerry Rogers, an MD and ADHD specialist, children with ADD are rarely impulsive and simply have trouble focusing, while children with ADHD have difficulty sitting still, concentrating, or focusing on conversation or learning processes. They consistently act on impulse and without thought for consequence. It just shows that the source that was used was irrelevant because it was focusing on ADD rather than ADHD. Second, education does not guarantee appropriate treatment from the parents, and professional training for parents often becomes a financial burden. According to the American Journal of Psychiatry, in clinical trials comparing medication, multimodal, and combination therapies, medication management was the least expensive when compared to the others. So even if parents have a thorough knowledge of the diagnosis, they can often become just as frustrated and weary as the parents who have very little knowledge or no knowledge on the condition. She also addressed the need to monitor specific diet components and exercise levels, stricter schedules, and positive reinforcement. This often alienates double-income families as a strategy because children spend very little time with their parents, and in this case it puts a larger burden on caretakers who are often responsible for 6 to 12 children at a time. So individualized care in this situation would be very difficult and not feasible. Her secondary claim, to address that one, I just said that placing responsibility of ADHD education and personalized systems for ADHD children will often result in isolating the child and also increased cost and time to the teacher. According to the American Journal of Psychiatry, the study that I previously mentioned also broke down the cost into components by calculating the salaries of all the professionals involved. The cost was categorized into a cost per child, and for combination therapy for behavioral and medication, it was approximately $7,827. For just behavioral, it was $6,988, and just for medical treatment, it was $1,180. So the highest cost was for the combination treatments, and the lowest was for the medical. She also addressed setting up a specific reward system, and that requires that the teacher use that and apply it to the entire class or cater to the one child with ADHD. According to Dr. Paul Romeliotis, an MD specializing in pediatrics, because no two ADHD children are alike, a personalized education plan is needed. And as I addressed before, this requires an increased amount of effort from the teacher and risk singling out that one child from their peers. Just a personal case I found was that a student in school who normally received A's and B's just simply needed extra time on tests and was afraid to ask for that special accommodation because he didn't want to feel like he needed extra attention. To address the secondary claim, she had a lack of evidence comparing the efficacy of medication and the multimodal approach, and didn't address at what point the behavior modification should be abandoned and moved to medication. The multimodal is advisable but not feasible, especially for divided homes, children in state care or foster homes, because there's no parental system or support system in the schools. According to David Rabner, a PhD senior research scientist at Duke University, there is no form of treatment that has been shown to be as effective as stimulant medication for the majority of children with ADHD. In conclusion, although my opponent had, although multimodal approaches can be effective and useful, it is not feasible that it's used in all cases, and it has not been shown to have a significant success rate and lacks feasibility for the majority of families.
All right, all the structural issues are fine. I think you did a pretty good job explaining a couple of problems with the generalizations that the advocate's using. I like the one point where you went particular on the type of difficulty that the book is writing about and how that is different from the one that the advocate's talking about, and therefore applying that generalization is a little bit problematic. I thought that was an interesting approach on that first point. You've got a lot of counterclaims here. It sounds like both you and the advocate are talking about policy claims here about what we ought to do, or what actions should be taken, or what the consequences of those actions would be. And I think that although there are some factual claims on them, sometimes both you and the advocate appear to be stepping over the line for this particular assignment. I did like, though, the conditional statement that you were putting into place about costs, and I thought you did a very good job developing that. You had good information comparing the relative costs to the different programs, especially the one that the advocate's talking about. There seems to be a generalization that some of these difficulties in using this type of system exist in two or three contexts that you mentioned: divided families, group homes, and adoptive situations, or like caregiver situations. And I think that you need to explain a little bit how frequently those are the circumstances under which these students or kids are operating under. If in fact that's a big part of the problem, then I think your argument may not apply to all of those situations. If it is, in fact, that's where most of those issues take place, then I think you've got a very good argument on the cost issues. I think there are a couple of good examples and hypotheticals that you used to explain things pretty clearly, and I thought that you had a good summary at the end of the speech, trying to explain how you're contrasting your point of view to the advocate's point of view. All right, thank you.